It's going to screen the population for mental health. The whole population. They're going to do it by stages, starting with school children, of course.
So far, mandatory mental health screening is not yet a reality, except for a few small segments of society. One of them consists of the most powerless and disenfranchised of them all, foster children.
A child goes into foster care, they label the child with some kind of a psychological problem. The child is immediately sent to therapy. Well, the therapist will say, well, I believe the child needs to be on something. So they recommend that the child see a psychiatrist to have the drug administered.
Out of the 60, 65 families that I see, easily 90% of the kids they have the mental health diagnosis to begin with. If they get it from a psychiatrist, it almost always comes with meds. And I think that we see identified as at-risk kids in the community, and we see some of the most intense situations. And a lot of them are on 4 or 5 different meds.
I've seen children that the day they're taken out of their parents' custody and placed into state custody, actually seem happy, healthy, vibrant, energetic. And then, 2 months later, after they began taking these medications, they are very slow. They are zombie-like, is the best way to describe it.
Today, all children entering Texas's foster care system receive mental health screening. The result? 60% of the state's foster child population is diagnosed and put on at least one psychotropic drug, including some children as young as 3 years old. And it is worse in other states. In Massachusetts, for example, 2/3 of children in state care are being treated for mental illness. Nationally, foster children are being drugged at over triple the rate of children in the general population.